Hey, this is Dr. Doreste with the cranial release technique, back with another video. Going to do something a little different. This is for my attendees of the CRT Mastery Review class that we had last weekend, the 15 people that showed up. And I wanted to make a video and I'll send it out to them, but it applies to any of the practitioners that are out there. And obviously, of course, I have a list here I'm just going to go through, but first of all, thank you for attending. It was a fabulous group. Nice to be back with all of my friends and family that are out there doing cranial release techniques, so thank you so much for that. One of the things, in addition to obviously the actual practical application of the technique, was the fact that I really stressed with them the concept of patient education. I can't overemphasize the importance of educating your patients on the concepts of the cranial release technique. Not on the detailed anatomy, but on the general concepts. The fact that we all have this primary respiratory mechanism, this involuntary cranial pump that's chugging along, doing the best it can. And what your job is as the CRT practitioner is to facilitate or enhance that movement. That's what the technique is designed to do. You are not looking at a specific bone and saying, I'm going to move it 3 degrees to the left or 3 degrees to the right. Your job is to enhance the primary respiratory mechanism to therefore enhance central nervous system function. I mean, it can be as simple as that, and we can go very deep on that concept as well, but that's really what it's all about. I mentioned to them a clothing designer in New York City when I was growing up. His name was Cy Sims, and his tagline always was, an educated consumer is our best customer. If you were to educate your customers or your patients or your clients on the concepts of the cranial release technique so that they really understood, imagine if they knew what cranial release was, similar to your understanding of it. They would be beating a path down to your door. They would be bringing their husbands, their wives, their children, their co-workers, their friends, their family, their enemies. They'd be bringing everyone, because everyone benefits from the cranial release technique, regardless of what the diagnosis is, regardless of what the issue is or is not. From the patient that wants to come in just to enhance his health and enhance his potential, to those that are coming in because they're having a health challenge. And everyone in between benefits from the cranial release technique from the day we're born until the day we leave this planet. Regular CRT care enhances function. Who wouldn't want function enhanced? So it applies to anyone and everyone. And remember too, I put myself a little note here to describe with you. Remember that you, as the practitioner, you need to also be the patient and receive CRT. So go to the website at cranialrelease.com and search to see if there's a practitioner for you to visit. Okay? I couldn't imagine life without regular cranial release. It's very rarely a day would go by where I don't work on my wife and she works on me. So that's something that we do on a regular basis, not because I have a health challenge, but because I want to optimize function. So, and if you look around and, like, for example, we had Amy, and Amy's the only practitioner in Colorado. Well, hopefully she's going to get a group of people together, practitioners, describe cranial release to them, maybe get them on the table. If need be, have me come in, whether it's a Zoom call or one-on-one calls, and just explain cranial release, send them to the website so that they can enroll and learn this work so that they can start doing it, and that you, as the existing practitioner, can go and get a CRT from someone else. You need it. You put out tremendous energy every day to patients doing cranial release. You need to receive the CRT as well. So keep that in mind, okay? All right. Again, I think the last thing I want to just cover is, and we sort of started off with it, the foundational understanding of what the cranial release technique is. This is a 12-step program. And when I say 12-step, there are other 12-step programs out there. I understand. This is a very specific hands-on technique which has 12 steps that we do on the left side of the patient, 12 steps that we do on the right side of the patient. And when you do those 24 steps together in harmony, the cranium opens of the patient. The primary respiratory mechanism, Dr. Sutherland's primary respiratory mechanism that he wrote about over 100 years ago, becomes enhanced. And as a result of that, overall function in the body is enhanced. Again, if you get that concept, practice can be very easy and very low stress for you. If you can understand that when you go into your office, your one and only purpose of being in that office is to apply this technique to enhance their function by enhancing their primary respiratory mechanism. That is your job. That's a very simple and easy way to go every day and to go in and work with clients every day. What do you do for a living? I practice something called the cranial release technique. What's that? That's something that enhances the primary respiratory mechanism. No one's going to know what that even means. No one's heard of that before. So now you're going to educate them, whether it's with the Hoberman sphere, whether it's with some of the other marketing and educational processes that I discussed over the weekend with the students. Some of the things I'll cover in future videos. There's no secret. My job, me, William Doreste, my job is to educate you so that you can go educate other people so that we can get more practitioners, so that these 8 billion heads that are going around on the planet, more of them can receive cranial release technique. That's what this is all about. That's what gets me going every day, is how do I get the word out to you, the practitioners, and you, the patients, about the benefits of CRT so that you can have a better life, so that 20, 30, 40 years from now, when you look back and say, gee, I'm so happy I started that cranial release work, either for myself as a patient or for me as a practitioner in practice. I've helped so many people. It's so easy, it's so gentle, but yet so effective and so powerful. So I think that's all I wanted to cover today. So for the people, again, the 15 people that showed up on last Saturday in Fort Lauderdale, thank you, thank you, thank you. We'll look at the schedule. We may schedule something. All of them said, let's do it again. Let's do it again. So we'll see. We'll see. I'm on a cruise right now. When I get back home next week, I'll take a look at everything and we'll put something together and I'll be back in touch with everybody, okay? Thanks so much. Have a fabulous week, everybody. I'll be in touch soon. Dr. Doreste saying adios, my friends. Remember the primary respiratory mechanism. Talk about it, understand it, educate people, do the CRT. As I explained over the weekend, the more you do CRT, the better you get. The better you get, the better your results. The better your results, the more you're going to want to do CRT. And it's just an upward spiral, and everybody benefits from this. Everybody benefits. You benefit, the patients benefit. Everyone wins with CRT. Thanks so much, everybody. Have a great day. Adios. Ciao for now.